Well, hello everyone. It's just a couple minutes before 7, and I just wanted to say hello. And we generally start pretty much on time. I usually like to give a couple minutes after the starting time just to give people a chance to get in from work and get settled in front of their computers at home. So. Um, I just want to welcome everyone that has jumped on already, and we've got 18 guests already. And I plan for you to hear some really, really, really good information this evening. So, where are some of you from? Can you type into the chat where you're listening to me from, and a couple other things. You are going to see an offer to jump on something called a discovery call pop into the chat room several times throughout the webinar. So please feel free to jump on that. That schedule fills up really pretty fast, and we already have people that are still on the schedule from a previous webinar. So we want everyone to have the opportunity to hop on for that very, very important, insightful phone call from myself and from my office. So you'll see something in the chat room to show up at various times throughout the entire webinar for a discovery call. And I encourage you to jump onto that and um, book a call so we can talk with you personally. The other thing is this webinar is only about 30 minutes. At the end, I am going to leave some time so I can do a little bit of Q&A. There may be some folks having some questions that someone else may also need the answer to. And so we will definitely try to get in a few questions at the end. Um, I also want to say that if you do see another person in this little screen here that comes in, if there's any technical problems, that is my IT director, and because I am a physician and I don't know very much of anything about computers, without his help, we wouldn't be able to have these webinars. So. You'll have to bear with me if there's any technical issues at all, which we generally do not have. So if you guys could please, let's see, maybe I'm not in the chat. Let me click in here. Oh, there we are. Okay. So, oh, we got folks all over Michigan. That is awesome, awesome, awesome. So happy to have you guys be part of this. Hello, Terry. How are you? Yeah, this is great. I'm so happy to have all of this participation. So we're gonna start in a couple minutes, but I appreciate everyone's patience in giving some folks a chance to get in and to jump in and to join us as they're coming from work. Okay. Okay, so it is 7:01. Hi there from Ipsy. I just want you guys to know I am in the Southfield, Michigan area. And for those of you that may not know where that is, let's see, here's the thumb, and I am right about here. Okay, right about there. Let me get my hand right. There we go. Um, right about there in Michigan. And so I've been there for over 20 years, and that's where my office is. Um, so we take care of wonderful people all over the state and all over the country. There's this interesting thing called Zoom and the internet, and all sorts of ways to do consultations all over the United States and even internationally. We've done that as well. So um, if you know people that need to hear this that are not in the state or anywhere near me, it doesn't matter. It really doesn't matter. So we are going to go ahead and get started. Okay, thank you so much for jumping on. um So again, we're going to talk about stress hormones and health and inflammation. And one of the huge factors also is belly fat. I know that everyone is concerned. Well, maybe not everyone, but most of us are concerned about losing weight, weight loss, and keeping that weight off. Not necessarily just losing the weight. We can all starve that weight off. It's all about keeping it off and knowing how to effectively keep it off without counting carbs and calories for the rest of your life. Who can do that, right? It's not realistic and it's never something that I advocate. But there's still an incredible amount of weight loss that we see in our participants and our patients, and it is just a wonderful wonderful thing to watch someone reach their goal. And it's not in a traditional way of starving yourself or counting carbs and calories every day. And I just want to throw that out there and let you know that when I do talk about weight loss, it is usually a very comfortable way to do it. The other thing that I want to mention is that I will be talking about a lot of different conditions and connecting some dots and helping you understand that because your body is a connected unit, because your body communicates internally with itself, that when you have an issue in one place, it may be affecting something that you don't realize in another area, and you will think maybe it's unrelated when it actually is very much related. So as I talk to you about stress hormones and health and inflammation and body fat, you're going to see that these things are very, very much tied in together. Okay. So let's go ahead and get started. I'm going to talk to you about my story. How in the world did I go from being a practicing physician, board certified in family medicine for almost 30 years, to talking to people, having these webinars, and helping people understand that there is hope, there is a better way to address your issues. And guess what? It's not in your head. If you feel like something's not quite right, your body is trying to talk to you. Your intuition is almost never wrong, right? And so I'm here to tell you that we're here to listen and that we know that generally when you feel something's off, it really is off. And so understanding that traditional medicine kind of poo poos that and having my own story to share is what got me here in what I'm doing today. So let's talk about that a little bit. So I get a phone call. It's probably about 6:30 in the morning, and this tiny tiny little voice, almost a whisper, is telling me that she can't feel anything on one side of her body. Well, if it weren't for me seeing the caller ID on my phone, I would not have known that voice was my mother. My tiny little 82-year-old mom said that she could barely feel herself on one side. So I call my sister who lives very close to her, and I meet them down in the emergency room. And there she is laying in the ER and on the bed with wires and cords and everything hooked up to her. There's two and three physicians coming into the room at any given time, and we're all trying to figure out what the heck is going on. Now, my mother really only has high blood pressure, so she was on two very common high blood pressure medicines, and we could not figure out what was happening other than the fact that we assumed she'd had some sort of a stroke, right? Well, after all the tests come back, we realized that that was not the case. And finally, after 2 or 3 hours of her being there, someone asked her if there was anything else she wanted to share and if there's anything else that may have changed, right? Although we'd already asked her that. Well, she remembered that about a week earlier, her doctor, who she loved for years, had given her a medication to control her cholesterol. He hadn't attempted to give her any dietary recommendations or any changes in that way. He just gave her that based on one test result. And after getting all of her studies back and thoroughly analyzing her, we realized that she was one of the few 15% in the country that had a severe reaction, a side effect to a very, very, very commonly prescribed cholesterol medicine. a cholesterol medicine that I had prescribed myself. How I thought to myself, how many times have I whipped out my prescription pad and done the same thing? So finally, at that point, I said, you know what? There's got to be a better way. There's got to be something else, a better way for us to approach these medical conditions instead of just constantly whipping out our prescription pad and using our pads and our medications as band-aids more than anything else. Now, I want you to understand I am not anti-prescription in any way. And there are some wonderful meds out there doing some wonderful things, keeping people alive. But do I think we prescribe medicines too much sometimes? Yes. Do I think we need to give the body a chance to do what it needs to do more and be a little more preventative in the way we treat our patients? Absolutely. And so as a result of that, I realized that even I needed to change the way as a result of the way that I practice. As a result of that, writing this very commonly prescribed medicine, how many people has it actually harmed? How many people has it harmed? And so that was my aha moment. Now I want you to understand that my mom now is doing quite well. And her cholesterol, with some lifestyle changes, has come down wonderfully. So I have seen it firsthand, and I know that there's a better way. And I know that there's some things as physicians that we can do better. And as a result of that, that is my story. And my beautiful mother is doing quite well. So there are so many people that have gone through the healthcare system, that have gone through and have been told that they are having, that they should just take this medicine or do this or do that, and or that things are all in their head. And as a result of that, many people are not being treated the way they should. And I'm seeing so many people that have come to me and said, hey, I have talked to my doctor and they think it's all in my head. I have tried everything that I'm supposed to do and I still can't get it right. Things are still not happening. And I'm beginning to wonder if this is going to be my fate. I'm beginning to wonder if this is going to be what I'm going to be like for the rest of my life. And I'm here to tell you that that is not the truth. And as a result of my experience and my quest and my desire to find a better way to help people, I discovered functional medicine. And so, what is functional medicine? Functional medicine is the practice of medicine that looks to identify the underlying cause of the medical problem, looks to identify what is the root cause. Let's go after the root cause. And then from there, we should be able to help you. And perhaps you won't need medication. Perhaps if you do, maybe a lower dose. Okay. Functional medicine looks for the underlying cause. And it is a beautiful way to look for and treat and help people get better. So I'd like to introduce you to a few patients of mine, and I have hundreds that I've helped. But I want to talk to you about Kim. Kim is a lady that came to me about a year ago. She had been in pain every single day. Kim has fibromyalgia and she was taking pain medicine. And the pain medicine really wasn't helping her. And as you know, fibromyalgia is autoimmune. It's an autoimmune disease. And Kim said that every single day she would wake up and would want to die because she was in so much pain. Well, after working with Kim for about 2 months, Kim reported to us that she was 90% pain free, that after a few weeks, she had gotten rid of all of her pain medicine. And for the first time in her life, she wasn't waking up with pain every single day. And then Kim reported that after about 6 months, she finally bought this motorcycle that had been her dream. Not because she just had a dream for a motorcycle, because she was always in too much pain to even think about riding one. And after about 6 months working with me and my team, because I can't do this by myself, I have a wonderful team. After about 2 months, excuse me, 6 months, she was finally able to purchase that motorcycle. And she rode it, and she said she rode like the wind for the first time in years. There's another one, though. Her name happens to be Kim as well. And this lady has 5 different medical problems. And one of them happened to be severe stomach issues. She had severe digestive problems. She was always in pain. Her digestive problems were so bad, she took 6 to 10 Tums every single night and was on 3 different prescription medicines just for her digestion. 6 to 10 Tums. After a month or so working with her, we were able to reduce her from 6 to 10 Tums to 1 to 3 per night and got her down to 1 prescription medicine. All of that was done in about 3 months. And she looked beautiful. I mean, after her body started responding in a positive way, she had this glow. You can see her face. She had this glow. She looked younger. It was just wonderful. But let me tell you about Molly so that you don't think I only work with ladies named Kim. Molly's in her 20s. She had severe PMS. Her premenstrual syndrome was so bad that she would have to stay home from work sometimes. Her premenstrual syndrome was so debilitating for her. The irritability, the mood swings, the menstrual pain, all of that. And after working with Molly about 2 months, she reported that she had a 180-degree change. Her symptoms were almost gone. Now, these ladies are all on my website and more. We're posting new testimonials all the time. But this is what I want you to understand. These ladies had thought that this was it. This was their lot in life. Nothing else was going to get better. They had already gone to their traditional physicians. They had already sought help even from specialists at the University of Michigan, who told them, this is it. This is what you need to take. This is the best we can do for you. And I'm here to tell you, ladies and gentlemen, there's hope. Okay? So let's move along. As a result of the work that I do and the successes that I've had in functional medicine, someone got wind of that, and I was invited to meet with Dr. Oz, who is a huge functional medicine proponent. He is a huge advocate of functional medicine. And one of the first things he said to me was that, your gut is your second brain. And I said, yeah, I tell people that all the time. But what a wonderful thing to hear it from him. So this was a great moment for me. These are all aha moments. This is why I went to medical school. This is why I studied so hard. These are the things, these are the outcomes, these are the results that I dreamed of having, but never thought I could help someone this much. I really didn't. I really didn't. I was caught up in exactly the way I'd been trained. And I'm a pretty good doctor. I've had patients with me for years. But results like this, these are things that you write books about because no one can believe it unless you hear it from the person themselves. So I'm just letting you know these all were my aha moments, but the first one was working with my mom. So you want to know, what's the take home from here? 1, there's hope. 2, why? Why is our system like this? How in the world did it get to this point where we're basically using medicine as band-aids? Where did that come from? How did the healthcare system get so broken? Why is it we are not practicing healthcare? What we're practicing is sick care, not healthcare, but sick care. We have the best doctors, the best hospitals, the best research, the best medicines, but yet we in the United States have the highest incidence of obesity, the highest incidence of heart disease, of high cholesterol, of cancer, of diabetes, high blood pressure. I mean, the list goes on and on and on. We lead the world in almost all the maladies that you can think of. How in the world does that happen to the richest country on the planet with the best of everything? Our healthcare system is broken. And there has to be a better approach. There has to be a better way, at least an adjunct, an additional method. When the other doesn't work, keep trying because there's hope. So here is part of the problem. Excuse me. This slide comes directly out of the Medicare handbook. This is part of their policy. It is care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary. This comes straight out of Medicare. This is their rule, policy, whatever you want to call it, number MCM 2251.3. Okay? Care that seeks to prevent disease, promote health, prolong, and enhance the quality of life is not considered medically necessary. Now you understand why the healthcare system is broken. So let me talk to you about how and why it can become better for you or one of your loved ones. So I want you to think about this. If you feel something is wrong, do you feel something is wrong and no one will listen? Do you feel traditional medicine has failed you? Do your test, here's the key, do your tests keep coming back normal, yet you know something's wrong? And the doctor says, oh, your test is normal, you're good. Okay? Don't ignore it. Don't ignore it. You're probably right. So, how do I do what I do? Let's talk about that. Let's talk about how we get past this and help you get better. Because there is something called negative stressors, and negative stressors can be internal or external. The thing about negative stressors is that sometimes you don't know it's a stressor. Sometimes you don't know. You understand emotional stress. You can feel that usually, but you don't know what the other hidden, I call them hidden stressors. And this is what we do when we work with you. We help you identify your hidden stressors because those are the ones that are as detrimental and deleterious to your health as the ones that you feel like the emotional stress. So let's look at that. The stressors lead to inflammation. That inflammation leads to hormonal imbalance. And believe you me, hormonal imbalance is the beginning of disease and chronic illness. Do I need to say that again? Your negative stressors, some of which you're not even aware of, and we'll talk about those. And when I work with you, my job is to help you identify what some of these negative stressors are for you, because your negative stressors may be different from your spouse's, and you live in the same household. Okay? So we go negative stressors, inflammation, hormonal imbalance, and disease. Okay? The next thing. So what are some of these negative stressors? What are some of these negative stressors? Physical stress. What does that mean? The lack of exercise or the wrong types of exercise is a stressor. That stresses your body. Chemical stress. The food you eat, the pesticides and preservatives on your food, the air you breathe, the water you drink. Even medication can be a chemical stressor. The side effects, right? These are all chemical stressors. These are problems for you. Okay? Emotional stressors. The road rage. Now here's the emotional stuff. The road rage, the having issues at work, the problems with kids, the problems with grandkids, any sort of emotional stress, that is an issue for you. And then, of course, staring at a computer screen all day. Staring at a computer screen, those are stressors. Staring at a computer screen is something we all do. It's something that happens, especially nowadays that people are working from home. Staring at a computer screen for several hours in a day affects the retina in the eye, which then causes a stress reaction. Those are stressors. And stressors, another huge stressor, is or are food sensitivities. Food sensitivities are stressors. And what are food sensitivities? These are foods these are not allergies, they're sensitivities. Allergies, you know it, you eat it, you break out, you get a rash, something happens, okay? Almost right away. So you know generally what you're allergic to. But sensitivities, you're not sure what they are. They could be your favorite food. They could be foods that you think are healthy. You could be sensitive to apples or oranges or lettuce or chicken or garlic or black pepper. And guess what? Those things lead to inflammation in your body. Remember, inflammation, hormonal imbalance, and disease. These are negative stressors, all the ones that I mentioned. Our job is to help you identify what yours are. Okay? So, stress affects every aspect of the body. So what happens? What happens when you get these hormonal imbalances? One of the first signs that shows up with these hormonal imbalances is your body shape. You weren't born looking like that, right? This is something that happened over years. This is something that happened as you started to get older. You didn't come out looking like this. These are examples of hormonal imbalances. They absolutely are. So, again, negative stressors, inflammation, hormonal imbalances. You want to know what your hormonal imbalances are? That first one represents estrogen, those menopausal type women, or that's a figure when you have an estrogen imbalance. Okay, very typical female uh, physique, right? Then you've got adrenal. That's the lady, the next one. Look at that belly. Okay, this is a hormonal imbalance that has to do with cortisol. And you get that little pooch in the middle. That's that middle age spread. That's that weight gain that sits right in your belly. Okay, hormonal imbalance. Let's look at the next one. This lady has a thyroid problem. Okay, she's overweight everywhere. And that man on the end, look at his belly. It's usually hard. We think it's a beer belly, but it's not. This gentleman has a liver and an insulin resistance imbalance, and sometimes that's a sign of toxicity. Remember the chemicals? Those are toxins too, some of them. So these are what your hormonal imbalances eventually look like as you get older. So if you look like this, if these pictures are staring you back in the face, you already are well on your way to having these problems that I'm talking about, to developing the diseases that have not surfaced. But you know what? When you look like this is the point at which you start to feel icky. You know something's not quite right. Maybe the word isn't icky, but it's like, something's off. I don't know what it is. I can't put my finger on it. And you've gone to the doctor, your tests are normal. 90% of the time, the tests are normal, right? Because they're not looking for the right things. Traditional, traditional medicine, the tests that we typically do on a regular basis when you go in for your physical are not going to pick up why you have these hormonal imbalances, okay? But you feel it. You're saying to yourself, something's not right, but you're looking like this, okay? Something is not right, and it's time to act on it and be proactive. So let's go on. What happens? What are the symptoms of these hormonal imbalances? You look like that, but you may have some bowel difficulty. And let me just preface this by saying sometimes you have a beautiful figure and everything looks like it's very proportional and you don't have the puffiness and the pooches and the and everything sagging in the wrong place, but you feel it. Ladies and gentlemen, listen to and pay attention to how you feel, because those feelings are real. So let's talk about when you have these hormonal imbalances. Sometimes your symptoms are bowel difficulty. And this isn't all, this says bowel, but it could be digestive. It could be digestive. And what is happening when you have these digestive difficulties? You have um you could have indigestion, you could have gas, you could have heartburn, you could not be digesting your foods as timely as you should, so it sits in your gut. And when it sits like that, by the time it finally moves out, man, you could blow out the whole house when you're in the bathroom because it smells so badly. Does any of that sound familiar? Okay. Bowel difficulties can come in diarrhea, can come in constipation, gas, bloating, indigestion, heartburn, all of that. Okay. All of that means bowel difficulty. Guess what? Your intestines are not happy. You probably have developed inflammation in your gut wall, and you definitely have leaky gut syndrome by then. Okay. So inflammation has already become your friend. How about this lady who is tired? This is another hormonal imbalance. This is another sign or symptom of hormonal imbalance. She may wake up with energy and then middle of the day while she's at work, she just tanks. She's tired and she needs energy. She needs something. 2 and 3, 4 cups of coffee a day. Okay? Just for that energy boost. Or she wakes up tired and she's tired at work and then when it's time to go to sleep, she can't. So this is a hormonal imbalance. Depression, anxiety, hormonal imbalance. Do you know you have to have a healthy gut in order to prevent depression? Did you know that? You need a healthy gut in order to prevent depression, anxiety, moodiness, mood swings, low libido. All of that is tied together with your gut. All of it. So if you're dealing with this, you most likely do not have a healthy gut as well. And you must have a healthy gut to be healthy. Your gut is your second brain, and it determines and communicates and influences the health of the rest of your body. Okay. Insomnia, again, this person may fall asleep, but then when she wakes up, she can't stay asleep, or maybe she has trouble going to sleep. All of these are examples of just a few examples of hormonal imbalances. And the leader of the pack is this weight gain. This is the person that does everything possible and they still can't lose weight. They've done all the weight loss programs they can think of and they still can't lose weight. Or guess what? They've starved it off, it's come off, but now it's coming back. You can't keep it off. Hormonal imbalance. It's not because you haven't count carbs and calories and done anything. So let's move on. Let's see what do we do? How am I different? I look at your pillars of health. We're committed to improving your health. You have different areas in your body that have to be assessed so that we can properly determine the best way to help you get better. It is not it is not something that just push away from the table or don't or start grabbing this supplement off of the counter or grab this because you saw it on the internet somewhere and we're going to fix this problem. Ladies and gentlemen, it doesn't work like that. Okay. It's a systematic approach that has to be taken, and it is involved in assessing you, getting appropriate blood test, and going through the process properly. Don't try to lowball it by fixing this yourself. Okay. These are problems that can lead to serious issues down the road. The process, what do? We start out with a 1 hour evaluation. Then we have laboratory testing. Then we formulate a plan to address the pillars of your health. And then we customize the best approach for you. That is my process. This is why we get those results. We have a lady that came in for blood work. She's 6 weeks in and she's already lost 25 pounds. She has asthma. She hasn't used her asthma medicine in 6 weeks. And she was puffy and swollen and would always get rashes, she said. She's had none. This is what I'm talking about, okay? It takes and it requires understanding the best way to approach you. So we know what the lab ranges are. We understand that the bell curve is not always accurate, okay? And we know in functional medicine that there's certain labs that have to be chosen. So let's just quickly talk about thyroid metabolism and uh, thyroid metabolism and how with your thyroid, it is really so important to understand that you have a thyroid hormone that's made in your neck, but 93% of it is comes out in the inactive form. You must convert it to the active form in order for it to do the work. So when you go in to get blood test, if they're only testing some of the thyroid tests, if they're not getting all of the thyroid tests that tells us if the inactive form has been converted properly, you're going to be walking around with an underactive thyroid hormone in your body. Yet you're told that your thyroid is normal, that your hormone levels are good. And I'm here to tell you, we diagnose underactive thyroid all the time because the testing that's done during the traditional screening test miss the type of thyroid hormone that we need to really see that tells us if you have an adequate amount. And what happens when your thyroid hormone is really low? Or is low in reality, is what I mean, your metabolism slows down. You're tired. You have brain fog. Your hair may thin. You have a low libido. Okay. Yet you've been told that your thyroid levels are normal. This is one of the most common mistakes in traditional medicine that we find. And this is how we know how to assess you. Insulin resistance, a big part of why you have belly fat and you had trouble gaining weight. I mean, losing weight. You have a lot of trouble losing weight and belly fat. And it's because you have insulin resistance, which is a consequence of those negative stressors affecting your body. And what happens when you have insulin resistance? You gain weight, and it's usually in the middle. You crave sugar or carbs. You have brain fog. You have fatigue, all of those things. And there's a direct relationship between insulin resistance as well as low thyroid. But that insulin resistance also is responsible for your high cholesterol, your high blood pressure as well. It all affects everything. Okay. So, understanding where your hormonal imbalances are is how we help you lose weight. You can't lose weight because you're insulin resistant, most likely. Okay. And it's not about counting carbs and calories, it has nothing to do with counting carbs and calories. It's all about understanding how to address your hormonal imbalance. Okay. We are almost done. So, hormonal imbalances show up in so many different ways. And sometimes it could just be fatigue. You're just tired, tired all the time, and you can't figure out why all the time. Your thyroid being low. You could be pre diabetic because insulin resistance leads to prediabetes and diabetes. You could have adrenal problems, adrenal fatigue. You're tired. Okay. Your sleep problems, hormonal imbalances, toxicities, your gut issues, autoimmune, nervous system interference. All these things may only present as fatigue. And if you don't know how to address them, your doctor is going to miss them. But this is what we look at. We know that each and every one of these problems is rooted in inflammation. Inflammation. Inflammation leads to inflammation in the gut wall, which leads to leaky gut syndrome, which can bring about so many problems. And when I see you for a consultation, I break that down for you and tell you where your problems are actually coming from. I connect the dots so that the issues and the problems that you're having, I am able to break it down, connect the dots, and relate it back to the problems that are concerning you the most so that we can identify the underlying cause. And then from there, start mapping out a plan to help you. Okay. So there's a logic behind this. And the doctors that trained me how to do this were nothing short of genius. Okay. So this is a very well respected approach. So again, we address your pillars of health because we have to be committed to improving you. So we put the pieces together. We have to look at you from a nutritional standpoint. You've got to detoxify. I'm sorry. There are toxins held up in your body that are causing problems and you don't even know it. Hormonal imbalance, your nervous system, like some of the neurotransmitters like serotonin and dopamine that have to do with depression, anxiety, and all of that. And fitness, you got to move the right way. Okay. So when we address you, some people have 4 pillars that are off, some people have 5, some people have 3, but we have to look at these. We put the pieces together in a systematic approach. Not having a systematic approach is why 94% of practitioners fail at helping you. Even naturopaths and natural um, supplement practitioners who only use natural treatment, if there's not a systematic approach, you might feel a little bit better, but you're like, something's not quite right. I got a little bit better, but something's still missing. And I know I still have something that's still not coming together. This is what I'm talking about. This is the systematic approach that I'm referring to. And that's why a lot of people come to me that have already seen natural providers because something's still missing. Okay. So, weight loss, decreased medication, feeling better, less fatigue, more energy, less pain. We have such great results with pain management and pain control and reducing pain and even getting rid of pain with ladies that have fibromyalgia. Isn't that amazing? I would never even believe that until now. But yes, we can help you tremendously with pain. Better sleep, improved memory. I mean, the list goes on. Lowered cholesterol, lowered blood sugar. I mean, the list goes on. I can't get everything on here. Again, a highlight, meeting Dr. Oz and understanding that there are some serious benefits, and him telling me that he was so pleased to meet me because I'm a real doctor going after some real issues the real way. And so this was great. So, how do you get help? What happens? I just want to show you a couple pictures. This gentleman, look at the belly. Does that look like our little people? Okay. And then we have him 4 months later. This is in the grocery store. We used to take you grocery shopping to help you see how to best pick your foods, but his wife sent us this. This gentleman lost like 40 pounds, 20 pounds, excuse me. He did extremely well. He was happy. We had gotten him off his some of his medicine. We reduced his blood sugar medicine, his cholesterol medicine. All of that was cut in half by the time we finished with him. Okay. This lady, this was in the beginning of the program. This is her 62 and a half pounds later, and that is at 4 months. I don't use like weight loss supplements or anything like that. This was addressing insulin resistance. All right. 8 months later, she was at 115 pounds down. And then I saw her a year later, she was at 125 pounds down. I have another lady, her goal was to lose 50 pounds. We saw her a year later. She still had her 50 pounds down, and she starts sending us other people to sign up because they were like, you are absolutely gorgeous. Here's another beautiful lady. This is her before. This is her 250 pounds later. It took her a couple years, but consistency and just following the recommendations we make. This is what I'm talking about, ladies and gentlemen. We're not talking about just losing weight for a couple months and then picking it back up when you stop eating what their meals and counting points and colors and whatever they're using out there. This is realistic. We don't restrict meats and things like that. We really don't. You're going to eat. You're not going to count carbs and calories. That's ridiculous. There won't be points. Who can keep that up for the rest of their life? This is realistically identifying your negative stressors that are causing the hormonal imbalance to begin with, one of which happens to cause weight gain. So when we address that, now we can help you use a common sense approach, which is not difficult because now you understand. You see in black and white in some of your tests what's going on. We help you find out what those are so that you can keep that ball rolling and keep that weight off. It's a lifestyle change. We're all about educating and helping you develop the smartest choices that fit for you. Your lifestyle change choices may not be the best one for the person sitting next to you, right? And if it doesn't fit for you, you're not going to keep it up. That's just common sense. So we have to approach you the proper way, but we have to understand what we're dealing with, and that's why we have to evaluate you first. So what do I do? Excuse me. I want you to ask yourself: can you predict the future of your health? Yes, by us ordering the correct test, determining the true underlying cause of the problem, focusing on the cause of the problem, not the symptoms, correct the dysfunction, and not alter the labs with medication. Give you more medicine, lower this blood sugar, increase the insulin, lower the blood sugar. No, it's not about that's altering the lab with prescription medicine. We're talking about getting you healthier, okay? Address the body as a whole. I said a systematic, organized approach and mentoring. We're going to mentor you along the way. We're going to hold your hand and educate and help you because you can't do this by yourself. Don't it's just you need support, okay? So again, weight loss, decreased medication, feeling better, more energy. Oh, this list is actually goes on and on. So what's next? What's next, ladies and gentlemen? Please jump on my discovery call. It's up to you. You know what you're dealing with. You know what your problems are. You know that you've been dealing with it for a while. The discovery call is nothing, does cost you nothing. Jump on the discovery call and see. Let us talk to you and see if this is something we can help you with. Let us talk to you and see if we think you're ready to make a change and to do better for yourself. Okay? Don't waste the discovery call time slot if you really aren't serious get about getting better. We want you to get better, and there's hope, and there is a way, and we're very serious about that. And we take a lot of time to help you get there. So it's up to you. I'm here. The discovery call is about 15 minutes. And if you jump on that call, we'll be able to discuss privately what some of your concerns are, and then make the best recommendation for you in order to move forward. The best thing you can do in your entire healthcare life is see me so that if nothing else, I can connect those dots for you and you will know what you need to do to get better. Stop wallowing in it, okay? Get better. So, again, the discovery call is the answer. And it has really been my pleasure to talk with you guys. Take action. Don't procrastinate. You've waited long enough. All right. You have waited long enough. So, again, you'll see the link in the chat room, and you'll be able to click that link and you'll go straight to my calendar. Straight to my calendar so that we can find out what the best thing will be for you. It's been my pleasure, and hopefully we'll talk very soon. So we've got a couple questions. There's always a question about insurance. Yes, we do take insurances. However, until I actually talk with you and find out during the consultation what we need to do for you, then I'll know what we can put through to your insurance and what we can't. It's not up to me. Insurances determine what they can cover and what they can't. So it's hard for me to answer that question without just coming in. Come on, just come in and see me, and you'll get those answers. But yes, and we for what's not covered, we are so affordable. I mean, we find ways to work with people on fixed incomes. We signed up a 76-year-old lady yesterday on a fixed income. We want to help, so we do the best we can with that. Okay. um how far out for the appointments to come in for a consultation? We try to get you in within a couple weeks of seeing the webinar because I do webinars on a regular basis, and the information is fresh. It'll be a lot easier for me to explain things to you. And it's so yeah, we can schedule out a month if you needed to, but usually within a couple weeks we can get you in. Um, oh, wonderful. She has we've got folks that have appointments for tomorrow. So let's see if I can scroll and see any other see any other. Okay. All right. So I want to thank everyone for coming, for listening in. It has actually been my pleasure. It's been fun. I think you've heard my kitty cat crying here a couple times, and that's okay. She's spoiled as she can be. But we will talk with you all soon. And until the next time, you have a wonderful evening and take care. Bye bye.